Evening, Jonathan. Well, I can tell you 93 people have received that BAM antibody treatment. Of those 93, only one person has ended up with severe enough symptoms to end up in the hospital, meaning it's doing exactly what it's supposed to. It's an antibody therapy that's hard to say. Yes, even for doctors.
Bamilivimab.
A few weeks ago, we talked to Dr. Klingensmith, who shared the whole point behind the BAM.
What we want to do is treat enough people with this antibody therapy that we reduce COVID hospitalizations to a point that's manageable.
Fast forward to this week, and hospitalizations for COVID are down, no longer in the triple digits.
Here in the hospital, we are at 250 patients in the house today. We continue to have very, very high census levels. But the COVID component of those, the active infections, is down to 65 today. We have another 13 patients who are convalescing, who have been in the hospital long enough that they're no longer considered infectious with COVID-19, but they're still recovering from the damage the disease has done to their bodies.
So it seems the BAM is doing its job.
We heard last night about the first hospitalization that's come from those 93 patients. Remember, these are all people with significant risk factors. So only one hospitalized out of 93 is a really good indication that maybe that's been an effective treatment.
The antibody treatment is for people who've tested positive for COVID-19 within 6 days. During that small window of time, they must be referred by their doctor and make an appointment for the 3-hour therapy at the infusion center. There's 13 appointments available a day. The hospital tells me they will keep doing the treatment as long as there's a demand for it. The hospital is not only crediting the antibody treatment for keeping hospitalizations down, they also believe that people are starting to take masks more seriously, along with social distancing. Now, the hospital, they were anticipating an influx in hospitalizations after Thanksgiving. They did not see that, but they are preparing for an increase in COVID-19 hospitalizations come Christmas. Reporting live in Midland, I'm Sammy Steele. Back to you, Jonathan.